sing. One, two. Thank you so much. One, two. Thank you so much. Thank you so much.
So where do I stand? Over here. Over here. Let me stand in the podium just for now. And then I will move. But we don't have a stage. You see this podium Can I start? Is somebody cue? Can I start? Can I cue? And then you must cue this place that. Can I start? Is the YouTube on? Can I just say something? Please pass me my phone there. Just timing myself. Just waiting for the YouTube link, so I'm not sure whether I should say something. Because now it's already 9:15. They're trying to see whether it's on. At 9:20. Right. Good morning, ladies and gentlemen. Good morning. Very good morning to all of us. And good morning to all those who are joining us virtually. We are still trying to check our technical abilities to see whether we are linked on our YouTube link. So we would officially start at 9:20. If you could just be patient with us. My name is Dr. Irene Mampa. When we start, I will introduce myself officially again. Thank you very much. Good morning, ladies and gentlemen. Okay. Good morning. Very good morning to all of us. Is it okay? And good morning to all those who are joining us virtually. We are still trying to check our technical abilities to see whether we are linked on our YouTube link. So we would officially start at 9:20. If you could just be patient with us. My name is Dr. Irene Mampa. When we start, I will introduce myself officially again. Thank you very much. Good morning, ladies and gentlemen. Good morning. Very good morning to all of us. Is it okay? And good morning to all those who are joining us virtually. We are still trying to check our technical abilities to see whether we are linked on our YouTube link. So we would officially start at 9:20. Just be patient with us. My name is Dr. Irene Mampa. When we start, I will introduce myself officially. Thank you very much.
Putting it in. So it's going slower than what we expected, but we're trying to change the date. expected, but they're trying to change the date. So,
Good morning, colleagues.
it's going slower than what we expected, but they're trying to change the date. So,
Good morning, colleagues, and welcome. Goeiemorgen, Locheni, Dimacheroni, Dumelang. It is a pleasure for us to be together in this momentous occasion. My name is Dr. Irene Mampa. I'm Head of Health at Impala Platinum Mine. I've been working at Impala. In actual fact, this May, I would have been there for 20 years. At Impala Platinum Mine, we cater for about 50,000 employees and 17,000 dependents. I am a member of the Mine Health and Safety Council and a member of the Mineral Council of South Africa. Welcome, ladies and gentlemen, and for those joining us virtually, as we today commemorate the 2022 World TB Day commemoration for the South African mining industry, which is hosted by the Mine Health and Safety Council under the umbrella of which we've got our tripartite structures in collaboration with the Mineral Council of South Africa, under which the umbrella there, we've got the Masoise health programs, which assist us a lot in combating TB, which you'll hear about. Also in collaboration with SAPCOA and also with the Gauteng Ukhozi Regional Tripartite Forum in the spirit of combating TB. Thank you so much to all attendees, both physically and virtually. Remember that we actually need to observe the COVID protocols, meaning that we need to wear our mask at all times, remember to sanitize our hands, and remember to keep our social distancing. I think one thing COVID has actually taught us is to basically enjoy the hygiene skills. And I think I haven't had flu, to tell you, for such a long time. If I have flu, I think I'll get very, very sick because I don't understand it anymore, because I'm always wearing my mask except for now, ne? And I think and hope that all of you have been vaccinated. And I know we are vaccinated with the Johnson vaccine, J&J vaccine, and also together with the Pfizer vaccine. As we commemorate today it is not a workshop. We urge you, please, not to ask questions, but if you have a burning question, to please wait for 2 to 3 minutes just before we go for tea and ask your question or your comment that you actually have for us. Or for the virtual attendees, please, you can put your questions forward in the chat box, and also in the chat box, we'll ask humbly our presenters to respond in the chat box. Well, the purpose of today is to gain great insight in the work the minds have done to combat TB. We have a beautiful range of presenters, and we thank those presenters for today as they will grace our stage and give us some information which will plant a seed in our brain as to how are we going to combat this TB, work together with who to end TB by 2030, and come up with innovative structures. Thank you. That is my introduction. For now, I'm going to request Mr. Dixon Muchetti to come through from the lodge and come and give us our safety emergency procedure. The floor is yours.
Let's please keep our mask on, sanitize our hands, keep our distance, and always, if you have got a flu or if you feel your temperature is going up or you're not feeling all right, we have got a sick bay and a place that we can isolate for you as we seek more medical attention for your own safety and the health of others around us. For our evacuation route, if something emergency that has happened here or there is something that you don't feel is all right, we have got our exit points. We have got one there with the green emblem on top that shows exit. If you go to my left, that is to your right, we have got one assembly point for us. That is by the gate that we use to gate in. And we have got another assembly point by the main gate just over the reception area. That is to my right. Please, if there's emergency, don't use the exit that I'm facing right there to the back. Let's go not under the roof, but let's go outside where there is no roof above us. So in our restrooms, they are on my left. At the end, there is where the restrooms, the gentlemen and the ladies is all there. There's a sanitizer by the door. If you get there, please make sure you leave it clean and safe for the next person that is coming. I thank you all.
Thank you very much, Mr. Muchetti. Now, I would like to introduce Mr. Charles Mukumani. He is an organizational labor representative of the National Unions of Mine Workers and labor convener of the mining industry for TB, HIV, and AIDS, and serves in the advisory committee at the Mine Health and Safety Council. Please come forward, Mr. Charles. Thank you very much.
Thank
Stage
you.
is yours.
Thank you, Chair. Good morning, colleagues. Ours is to do the less we forget as organized labor. My name is Charles Mkumane. I'm representing organized labor in the SAMI and as a convener in mining industry advisory committee at the MHSC. We want to put just two points before we do that. First, we want to appeal to the mining industry to continuously look at the conditions, the living conditions of our members. I think so long as our members' living conditions are not improved, I think TB will always be a problem in the mining sector. We also want to take a challenge that has just been raised, that TB seems to be affecting more men in the sector. So we want to say to this forum, we will take this up to the organized labor caucus and discuss it. I want to promise you that we want to embark on campaigns regarding that, so that we want to get to know why men are not, coming forth in terms of, doing the screening. So we want to appeal to management in various mines to assist organized labor in doing so. With that, we want to then ask you to raise in honor of those who left us due to COVID, TB, HIV and AIDS in the mining sector. Can you all rise for a moment of silence? Thank you. You may all be seated.
Thank you very much, Mr. Charles Mukumani. You know, there's one thing we pointed out, that men are less diagnosed than women. I just believe maybe women, you know, we get used to visiting the doctor because we tend to give birth, and then we train, you know, as it is, we need to take care of the family, we need to be healthy. And I don't know whether maybe the doctors are handsome that we visit, so we don't know. But it is imperative that each and every individual goes and sees the doctor and gets diagnosed for HIV and TB, and especially in this day and age. Many years have passed since we had HIV. I mean, I was still a student at Wits University in 1995, where we used to wear, I mean, the professors and registrars, they used to wear those hazmat suits when they approached an HIV positive individual. And nobody understood exactly what was going on, you know, at that point in time. And even up to today, we're still grappling with it. There are those individuals that today come through to the hospital newly diagnosed with very, very low CD4 counts of below 200, with TB, and also with COVID-19. So we need to still pass the message and sing a very strong song on making sure that you get diagnosed for your HIV, making sure that you drink your tablets, they're there. 1 tablet a day, at least we have also reduced the pill burden. So it is very important that we encourage our men, please, visit the doctors. Try and find out what is wrong with you. There's nothing wrong with that. It is to assist us, to assist you to live longer. I think that is the message that we need to pass through. Now, I would like to introduce Ms. Florence Mahampa, who is our Occupational Health Program Manager with the Mine Health and Safety Council, MITEC, and Mine Occupational Health Advisory Committee, to come through and inform us about the purpose of this event and introducing the theme which will set the stage. Ms. Florence, kindly come through. Thank you very much.
Good morning, everyone. Standing before you as introduced, this is Florence Marampa, and I am the Occupational Health Program Manager at the Mine Health and Safety Council. And basically, my duty on behalf of our chairperson at MITEC is to just formally introduce the purpose as to why we are all gathered here, and also just let you know what the theme is for this year and why we have basically chosen it. I will not go into detail in terms of the theme because it will be covered at a later stage. So with that being said, colleagues, allow me to then continue. Okay, so the presentation I'm going to take you through is very, very short. I'll just do 3 things, like I said, just the background, the purpose, and then we'll talk to the theme as well as the slogan. So in this year of 2022, colleagues, were in the 140 year since the discovery of the mycobacterium tuberculosis, which is known to cause tuberculosis and has been responsible for many deaths. In 1882, particularly in Europe at that time, as well as in the United States. And we do know that since then there's been quite a lot of interventions that have been made, but we do know also that there is still quite a lot that still needs to be done in eradicating TB, and hence these commemorations are actually very important With that being said, colleagues, the MHSC has been commemorating this event on an annual basis, except for in 2022, as has been alluded, due to the disruptions with COVID-19, but we have readjusted, and I think in the past year, we actually had this fully physical, and in this year, with restrictions being lifted, we then thought, let's rather do it hybrid. Let's learn, to crawl before we can actually then fully go for this physical event. We can go through. So basically, colleagues, we are gathered here in tripartism, but also in partnership with our strategic partners. As has been mentioned, we have Masoisa Health Program, which have partnered with us in hosting this event. We also have SABCOA, who are the secretariat for SENEC, and they are responsible, as we know, for the national TB commemorations that actually happen. And we also have the Gauteng Ukhozi RTF, which we have partnered with. And I really must say that, Ukhozi has really come to the party, and we will see later on, even in terms of the minds that have agreed to partner with us in doing awareness campaigns during this month of March. So we are really excited about that, and we really just thought, what? A lot of work has been done and continues to be done in the big mines, and it's really about time that we actually illuminate on the wins of the small-scale mines, but also that we really just give them that platform to show us how much they have progressed in as far as eradicating TB. With that being said, colleagues, the other reason we are actually here is really as a sector to reflect on where we are in as far as TB is concerned. And at a later stage, Dr. Mgobodo will be giving us the stats, talking to that, and also just to really talk to where we are wanting to go. We have targets that were set in 2014, colleagues. Again, we will talk to that at a bit of a later stage, and then we will be talking to, where to from here, in as far as that is concerned. And we also, as has been mentioned, we are wanting to demonstrate the importance of collaboration, colleagues, and hence I've mentioned so many of the partners that we have had, because we do realize that we cannot win this fight of eradicating TB on our own. So collaboration is very important, and today it's really just also about really emphasizing that. And then further to that, colleagues, we wanted to raise awareness. Commemorations are really a great time wherein we can really just, raise awareness, remind people really of the importance really of fighting TB, because it has claimed many lives. And again, at a later stage, you will be told about the stats. We do know that TB is preventable, that is also curable, but it does continue to actually claim many lives. So really, awareness, colleagues, is very, very important. And you would have seen outside also that there have been awareness packs, and we have also been doing build-up campaigns, not only here in Gauteng, but also in other small-scale mines across South Africa, and this will be talked to also at a later stage. And not only that, Mr. Siyajigwana from SABCOA will also talk to our participation as well in the Northern Cape, in as far as SENEC awareness campaigns are concerned for the national commemoration. Then lastly, colleagues, we are really here to really just honor the lives of those people that are fighting this pandemic at this stage. But not only just TB, but also HIV and AIDS, and also those that are really fighting COVID-19, which I really do believe it really affects all of us. And we are also wanting to really just sympathize with those that have lost their loved ones due to TB, as well as HIV and AIDS and COVID-19. So with that being said, colleagues, these are the themes that have been released from both the global level as well as the national level. And you will understand that on an annual basis, the themes that we actually come up with as a sector are always aligned to the two themes. So in terms of the global theme, colleagues, as you can see on the screen, it is written invest to end TB, save lives. And as far as the national theme is then concerned, it's invest in action to end TB now. Get screened and stigma, save lives. And in support then of the two themes as well, and looking at where we are as a sector, we then thought our theme then should also incorporate the two. And therefore, you would have seen when we sent out the save the dates, the invitations, as well as the awareness campaigns throughout the month of March, we have been emphasizing the fact that we need to invest in action to end TB, but not only TB, but also HIV and COVID-19. I think in the past 2 years, we have been talking a lot about having an integrated response, and that's really the direction that we are going, colleagues, as a sector. So that's the theme: invest in action to end TB, HIV, and COVID-19 in SAMI Now, Save Lives. And the slogan to that is called Get Screened, in brackets for TB, Get Tested for TB, for HIV, for COVID-19, adhere to treatment for all the 3 diseases that I've mentioned, and also get vaccinated. Like I said, at this stage, I'm not going to break it down. In the later stages, it will be broken down, colleagues. And with that being said, I do hope that we actually enjoyed today's session, and thank you for your time.
Thank you very much, Florence, and thank you very much for the round of applause. How do we do it? We do the 1, 2, 3, like. Can we do it like that? Wonderful. Thank you very much. So we are investing to end TB, in an action to end TB. And it is a process. And a process requires a collaborative effort. And a process meaning that for many, many years since I started in the mining industry, the Mine Health and Safety Council, the Mineral Council, SAPCOA, everybody has been working together in awareness, procedures, and policies to ensure that they give guidance to the mines to assist them in awareness and treatment of TB and HIV. But TB is, like I always say, TB is a weird disease. You know why? Because you have to prevent, and then you diagnose, and then you treat, and then you still prevent from not having TB again. We always say prevention is better than cure, but TB just takes the whole estate. Instead of HIV, we know you prevent, you don't have it, But with TB, the possibility of you having TB, even if you prevent it, it is still actually quite high. So it is important for us to intensify our screening and our awareness campaigns. Ensure that everybody in the South African mining industry, even nationally, that they're actually screened. Because I have that husband, that wife. I work at the mine, but the husband might work maybe somewhere. I have TB, but I must ensure that the whole family is screened. So that is the important message that we must also pass through. Now, I'm going to introduce Dr. Lindiwe Mvusi. She's going to do a virtual presentation for us. I'm going to request her humbly that while I'm still introducing her, if she could show us maybe her face on the virtual so that we know who we are talking about. Thank you very much, Dr. Lindiwe. And she is the director responsible for drug-susceptible TB in the TB control and management cluster within the National Department of Health. As we know, we have to work in collaboration with the Department of Health. She is a medical practitioner with a postgraduate training in occupational and public health and has worked in the private and public sectors to joining the Department of Health in 2001. Her presentation is on national and provincial state of TB and HIV. So let us give her the podium and welcome her on stage. Thank you very much. Dr. Lindiwe Mvusi.
Thank you very much for that introduction. And I'm just trying to load my slides, so for the delay. Just to say that to check if I'm audible and you can see the visual, my face. Colleagues, what I'm going to cover today is basically just give a very brief overview in terms of the progress with TB in the country and highlight some of the challenges as well as some of the plans going forward. In terms of, oh no. In terms of the background to this, can you see my slides now?
Not yet.
Not yet.
Yes.
Let me try it. Let me try and retrieve them again. Sorry about this.
In the meantime, while she's still trying to sort out the technical issues, South Africa, in actual fact, has been seen as one of the 30 countries with a high TB burden. What do I mean about that? We basically have TB, we have TB and HIV, and we also have MDR. Now, great strides have been done in diagnosing TB on itself, TB and HIV. MDR also, even the treatment of MDR, great strides have been done from reducing the treatment duration of MDR TB from 18 months to 9 months. And that is because of the newest modalities of treatment where the Department of Health is basically using bedaquiline, which are the newest agents, and together with linezolid. And that has helped a lot. I mean, you could imagine how long it will take for an individual not to be at work, 18 months out of work, because they are drinking, the tablets, and that used to affect them financially a lot. Dr. Lindiwe, are we getting there? I think I can see progress.
Yes. Oh, can you see my slide now? Sorry.
Yes. Oh, yes. Wonderful. Thank you very much. I think you can enlarge the view and then start with us.
Okay. Thank you very much, Chair. As I indicated earlier, I will just provide the background. Let me go through it. I'm hearing feedback. I'm not sure what's going on from my side. Okay, let me. It says that my slides are not.
Doctor, what we're going to do is to see whether we cannot assist you with presenting from our side. As we can see, you're struggling. You do have it. You do have it. If you can just enlarge it.
They are moving now, right?
Yes.
I think I'm
Yes,
sorted. The slides are
moving.
moving now.
Yes. You can go into presentation mode.
All right, thanks. I think I can't hear you that well. But let me get going.
Yes, please.
So, colleagues, the challenges, the TB burden trends currently in the country are that we do have a decline in the TB incidence, which is now estimated at about 328,000, which shows a 48% decline overall since 2009. We also have seen a slight decline in TB mortality, sorry, not a slight decline in TB mortality, but the decline is 67%. And we're seeing that most people that have benefited from this are the people living with HIV, where we saw a large decline in people living with HIV and a slight decline in those that are HIV negative or do not know their status. And in most cases, the gains that have been achieved currently are mainly due to the scale-up of the ART program, including prevention of TB in that group. When it comes to outcomes, we haven't really done well. This graph here just basically shows the districts based on the performance. So as you can see, we have those that have done well when it comes to treatment success and those that have not done so well. The same would apply to loss to follow-up, which is the orange line, and the small pink bars, orange bars and pink bars. The small pink bars are mainly failure, which remains persistently low. And the blue bars then are the dyed, light blue are dyed, and then the darker blue are not evaluated. So when you look at the losses during treatment, this is now standing at 9.9%, and only 5 districts have actually attained a target of less than 5%. When it comes to treatment success, I forgot to mention it's about 3 districts that have attained the target of 90%. And then TB deaths remain high at 5.2%, and only two provinces have attained a target of less. Yes. Oh, sorry. I forgot.
That's better. Thank you.
And sorry, I forgot to do that. And the treatment failure remains low at 0.4%, and patients not evaluated at 4% as well. Now, this highlights mainly some of the challenges that I will talk to later on. But before I get to those, I want to remind colleagues in terms of the TB care cascade that we have. This is a national cascade, and we've tried to also develop not a cascade as such, but targets along the cascade. Now, when you look at the cascade, we have the TB incidence, and I must indicate that this was for 2018. The incidence was then estimated at 390,000, and as you noticed, it's actually come down from 390. This was based on the revisions we made after we had the national TB prevalence results. When you look at the next bar is mainly TB testing, and those that were diagnosed, notified, and then successfully treated. The last bar, we're not necessarily following up currently based on our guidelines, but it's looking at the status of the patients after 12 months of completing treatment. Now, as you can see, there are leakages along the bar, and the care cascade from reaching everyone who has TB with testing services, screening and testing services. And again, we diagnose patients, but we still don't start all of them on treatment. And even those that are started on treatment, only a few actually complete treatment. We also had COVID from 2020, which actually negatively impacted on the program. Looking at the drug susceptible TB notification trends here, we're comparing the 2019, where we were in 2019, with the 2020, which is the middle bar, and then 2021. Sorry, 2021 is the middle bar and 2020 is this one. So as you can see, round about March, this was almost a week after the declaration of the lockdown. There was a sharp reduction in terms of the notifications, and there were a number of reasons for this. But around September, when we moved from level to level 2, there was an increase in terms of numbers that we're seeing. And a similar pattern for DR notifications was also observed, but here it's just comparing the 2019 to the 2020. And as you can see, there's huge losses in terms of notifications for that group as well. Now, we then had to develop a TB catch-up or recovery plan, which we have just revised recently, implementation in the new financial year, which starts from tomorrow. And this recovery plan actually covers a number of key objectives or areas that we need to strengthen. One being we still need to focus on finding people in the communities who have TB and link them to treatment, trace all those who were lost to follow up. This is either during the lockdown or post, at least in the new, the last quarter of the old financial year. And also strengthen the systems for linkage and retention in care, monitoring and evaluation systems, infection control, and intensify the communication and social mobilization aspects. Lastly, to engage all sectors in the TB response. Now, just looking at coming back to the cascade and what the intervention under each of the areas or the pillars of the cascade. Under the first 90, that's where we need to reach people with undiagnosed TB and then test them as well. So this, there are a number of suggested activities here. First of all, to conduct hotspot campaigns, which will be informed by geomapping of areas with a high burden of TB, and then conduct contact screening for all household contacts of people diagnosed with TB, and also screen key populations that are at risk who may not be presenting to facilities, and use digital x-rays for screening. We know that the symptom screening tool has its own limitations in that it's not that sensitive to pick up most people who have TB. We also have a TB health check platform where people can then screen themselves, and if they have symptoms, then they can present to facilities. This platform can be downloaded onto, what is this now, smartphones as a WhatsApp, or it can then, it also uses SMSs. We lastly, also the next part is around testing. Here we're looking at mainly testing certain high-risk groups irrespective of symptoms. And these would be people living with HIV, previously treated people as TB patients, and then household contacts again. And also introducing and scaling up new diagnostics. We've had the Expect Ultra for quite some time now, and which is more sensitive than the previous cartridge that we're using. But here we're also exploring reaching children, especially because we have difficulties in obtaining a sputum in children, so we're exploring the use of stool in GXP testing. We've introduced the urine LAM, which is specifically for PLHIV, and XDR cartridge, which we are planning to actually introduce this in the new financial year. Now, with linking people now with a positive result to treatment, We are looking at communicating results directly to patients using SMS system, strengthening the referrals. We are currently sending out weekly and monthly alerts from the gene expert test for both the rifampicin sensitive and resistant TB. So we'll strengthen the use of those alerts that are being sent out. And for MDR TB to decentralize the care. As you know, it's more centralized. We are in the process of ensuring that each district sub-district, does have a treatment site for MDR. On retention, we're looking at digital health solutions to actually promote adherence, sort of supporting them remotely. And we're going to also intensify or strengthen the use of the existing adherence counseling package, introduce newer regimens.
Can you hear me? Can you hear me? It's Dr. Mampa speaking.
Yes, I can hear you. Yes.
We are now giving you an extra 5 minutes to complete. Thank you very much.
Oh, okay. All right. No, that's fine. The rest will be short. And then again, I think lastly, including TB in workplace policies. The prevention strategies have been referred to, but in congregate settings, we strengthen infection control, use of cough hygiene or promotion of cough hygiene, scale up treatment for latent TB infection, and even increase coverage for BCG. And obviously, all these will be supported or strengthened by having a robust M&E system, strengthening ACSM activities, capacity building, quality assurance. Cross-cutting issues around M&E, as I mentioned, communication and strengthening the governance of the TB program. Now, the priority interventions, I think here I'll cover those that I haven't mentioned. One was looking at integrating screening and testing for TB and COVID, and also strengthening the notification system and community outreach services. For treatment, we're introducing the shorter regimens, 3-HP and 3RH for children, and expanding the use of TPT to all household contacts. There are critical enablers that we have outlined in this plan, having the guidelines and also SOPs, improving the data systems, and here we're aiming at improving the quality of data, develop a public-facing dashboard, and improve the quality of services, as I said, and engaging partners, civil society, and business. Now, in conclusion, COVID has reversed the gains that we have made until 2019, and the number of people with undiagnosed TB is standing at 254,000, and we've also noticed that the notification prevalence gap is highest in men, young people between 15 and 24, and in older people more than 65 years. So our interventions will be targeting at finding these people. And again, children have been a neglected group, so there'll be more focus on children. And the other challenges that we face are related to implementation of TB prevention strategies, the suboptimal communication, and a weak TB surveillance. So that, in a nutshell, would be the focus
Thank you. Thank you. Thank you very much.
At least for the 1 year of this.
Thank you very much. Thank you very much.
Yeah,
Dr.
thank
Lindiwe.
you very much.
Thank you very much. One important fact is that the slides are going to be shared, so we'll have the opportunity to peruse them at our own leisure. That is very important. And what Dr. Lindiwe and Vusi pointed to as a nutshell, which is very, very important, is how COVID affected our intensive screening and contact tracing on TB. I actually have one success story that I want to inform you about. It's about one of my colleagues diagnosed with COVID, treated them very, very well, nicely. They left the hospital. They continued to work, but however, they came to work limping, and they were limping for quite some time, and I didn't understand the limping and the COVID. So I sort of watched him for 3 weeks, and then after 3 weeks, I told him, come here. I need to understand why you're limping. I thought it was gout. I did an x-ray, and I could see that the bones in his left foot were moth-eaten. Now, that didn't make any sense, because that colleague of mine also has HIV. They went for a biopsy, and they found TB in the foot. Now, TB in the foot, the last time I heard about it was in the 20th centuries there. And I mean, it's HIV positive. I would expect it to be in the lungs or all over the body, but I found it in the foot. But no, it wasn't not even TB in the food. It was MDR of the food. So it threw me completely off. So what does this mean? It means we must have integrated programs of HIV and TB and COVID together. Because the minute an individual has COVID, it means you still have to exclude TB. The minute they have HIV, TB, and COVID, you still have to exclude TB. With every test that you do, you have to exclude TB and ensure that that individual gets the correct treatment. One of the things that she also talked about is the loss to follow-up, case finding, contact tracing. We in the South African mining industry, we are so fortunate to have the Masoyiso Health Program. You know, when we started the contact tracing with the Masoyiso Health Program, it was like, they are now infiltrating our space. We didn't know why they were there in the very first place. But it taught us a lot of things. It taught us to do case finding. It taught us to look at our outcomes to ensure that the people have actually received that treatment. We even went further to look at the children to find out whether did they actually receive INH prophylaxis. We went even further to ensure that the children, if they were diagnosed with TB, were they actually treated. We went to the local state clinics and ensured that they completed treatment to tie up the whole loose end. So it is our responsibility, together as a collaborative effort with the Department of Health, to work together against combating TB and ensuring that COVID-19, and I think we are all happy right now. It's actually been quite nice and quiet with COVID, and we pray that the next coming June month is going to be very quiet, and we pray now we will just sort of continue to intensify our efforts, but we must ensure that we combine the three together. Now I'm going to introduce Ms. Ipile Mokhorosi. She is an occupational inspector at the Gauteng Regional Department of Mining, Minerals and Mining. She is appointed as an alternative member of the Mine Health and Safety Council, Culture Transformation Advisory Committee. Her presentation is going to be on the regional stats on TB, HIV, and AIDS, and COVID-19. Welcome. Thank you very much. Mic on.
Okay. Sorry, ma'am. I just want to check online. Can everyone hear me? Are we okay? Or maybe a thumbs up, please. Everything there? You can see the presentation. Okay, I'm not getting a feedback from anyone online. Can someone just
Yes, yes, yes.
Okay, thank you, Dr. Balko. Then you can see the slides as well, man.
Yes, very well.
Thank you. Please go ahead.
layout of my presentation, we are basically going to be dealing with the background, HIV/AIDS status in COVID-19, and PTB status and the challenges that we are facing as a region in conclusion. The background. All the information that is contained within this presentation is the information that the region got from the DMRE form that is called Form DMRE 164. And the form normally gets to the office from early January up until end of February. And this is statutory reporting, so each and every employer is compelled to actually submit the form. The period, as I have alluded, is from last year, 2021, from January till December. And the information, the importance of the information is that the region is trying to be informed of what is happening around the region in terms of COVID, HIV, and PTB. And this is going to inform us in the future so that we can actually change or formulate guidelines in order to assist the industry. Thank you. In terms of COVID-19, I have taken the whole states of the region, like your bigger mine and the smaller mine. So I've tried to divide the smaller mine like you saw there. Cumulative positive cases thus far for small mines. The small mine has contributed 187, and in terms of recovery, 179 thus far, and death, only 2 is from the small mine. And the test conducted that was initiated by each and every operation is 475. Those are the stats in terms of the HIV. And this, as I've alluded earlier, is from the form that we call 164, DMRE 164. When you look at the testing for HIV thus far, total testing, it contributed 391, and then the positive cases is 63, and newly diagnosed for 2021 is 34. And then with PTB, suspected people that went through and did the screening, but when it came to the, when they were tested for the actual PTB, like maybe with the x-rays, it showed that they suspected TB, but when they do the actual test for PTB, it did not confirm TB. That's why I'm saying suspected PTB. It's actually, for suspected is 19, and then confirmed PTB for small mines is 1, and MDR is 1. The challenges that we are facing as a region is that we are still having problems with the employer giving us late reporting. That is the biggest challenge, because as we are sitting now, other employers are still bringing in the forms. And that is delaying because Dr. Mokoboto's office needs to collaborate and make a conclusive report that is given through to Parliament. Some of the employees still using outdated form. And when you look at the outdated form, you see that it does not cover the changes that were made with the years, with new development. And that is frustrating actually to the data capturer and also us as occupational medicine inspector. Employers, some of the employers are just submitting for the sake of submitting. When you look at the actual form, you'll see that they did nothing in terms of VCT, in terms of awareness, nothing. So you are asking yourself, are they not interested in seeing what is happening within their operation at large? So that's the thing. And when you look at the form, the information that I've given, it looks as if PTB does not pose a problem, but that stands to be something that we need to discuss, because based on the suspected cases that I've alluded to, 19, where did that fall to? And we should remember, with the small mines, all the employees are not obliged actually to disclose with regards to PTB or HIV. So it becomes difficult if nobody is coming forward or volunteering information. So the OMP will only know what they know, and that is it. So I'm posing this question to all of us. How much efforts are needed in order to assist the industry so that we, all of us, can know our employee holistically? I'm just thinking, Masoyisi, maybe that's the start. We'll see how it goes next year.
I agree with you.
All right. Next slide, please. That is just a link to show what are we faced with as a region, if it can open. It's not open. Okay. But basically, I was just trying to show the audience that the forms 00, and those are the things that we are expecting the OMP to do when they do when the employees are conducting medical surveillance, like your PTB screening test. That is a given. It's actually a question for one of the tests that is being conducted during medical surveillance. When you do when you check for the patient's lungs through the test that we call the VUTA. I don't. Most of the employees call it the VUTA. That's it. So that is the thing. That is compulsory. So you're asking yourself, is the OMP not doing it, or during the time of the filling of the form, he did not or she did not consider it? I thank you.
Thank you very much. Mr. Ling. Thank you very much, Ms. Mukhorosi. And I think it is a challenge. We rely on the information that is basically provided to us to assess the trends, to know which lines we actually have to reach out to go and assist, especially with screening of individuals. The information that we receive from the DMR The information that we receive gives us a lot of insight as to which OMPs, occupational medical practitioners, we need to assist. So we urge you to please assist us with that information. It's very, very important, including the presumptive cases. I know it is very difficult to look at the stats for the presumptive cases. I used to do it a lot. But Mr. Billing, thank you very much for this wonderful presentation. And I think that going forward, more workshops should be done to educate the occupational medical practitioners on filling of the forms and the importance of those forms, that information that is required. I'm going to introduce somebody that I've known for quite some time, Dr. Dipalisa Mukuboto. She's going to present to us virtually. So if you can hear me, can you please show us your face so that we can see whom we are speaking to? But she is a medical inspector at the Department of Mineral Resources and Energy after having worked as an occupational medical practitioner in the mining industry. She's also a state convener of MITEC and a member of MOHEC within the Mine Health and Safety Council. She's currently the president of Mine Medical Professional Association, which is MMPA, and her presentation is going to be on the South African mining industry update on TB, HIV, and AIDS. Well, there she is, the beautiful lady. Thank you very much. Can you hear us? You seem to have a little bit of static on your side. Can you hear us very well? You can unmute yourself.
Yes, I can.
Ooh, lovely. The podium is yours. Thank you very much.
Thank you for that introduction. I will switch off the video and then try to load my presentation. If you could kindly indicate if it's on, and I'll put it on slide mode.
Yes, it is on. Can you please put it on slide mode? Thank you very much.
Thank you. Good morning once again, everyone who's attending. It looks like it's a pity one could not be there physically. And I have been experiencing a bit of problems this side, seeing other people's slides, but at any rate, at least the program director is there, so I don't have to really follow much. Today, I'm talking to TB and HIV stats in the South African mining industry, as alluded to before, as collected from the DMR E164 forms that Ms. Ipeleng was talking about. This is my presentation outline, a brief introduction with background and looking at the milestones, the submission trends, compliance per commodity, the TB trends over the past 6 years, showing you the national picture. Ipeleng has covered the provincial picture. I'll give the national picture. TB screening trends nationally and the incidence trends, and also cover HIV trends as well and conclude. As a way of introduction, and I think the program director has done a good job about that, and we all know that TB remains the leading cause of death among HIV-infected individuals in South Africa, and it is actually driving the TB epidemic in South Africa. And the co-infection rate was reportedly at 59% in 2019 in South Africa. And it is clear that we need to have a coordinated and integrated response to win the war against the dual epidemics of TB and HIV. Global TB statistics show that COVID-19 pandemic has resulted in a big reduction in newly diagnosed TB cases, and that we've already had. And the latest TB incidence rate in South Africa, according to WHO, is estimated at 615 per 100,000. And in South Africa, we're still gearing up to reaching the 1990s targets. And I think Dr. Mvusi covered that. As a way of background, in terms of where we're coming from as MITHEC, to be connected with this TB and HIV, we all know that in the early 2010, status of TB and HIV was not known, although the mining industry was collecting data on TB and HIV in their workplaces. But it was not something that was, they were doing it individually, and it was not reported. And then in the NIOH was commissioned to at least get a prevalence of TB and HIV in the industry as a starting point. And from that survey that the NIOH did, there were recommendations that were made, such that one of them indicated that the mining industry had to start reporting on TB and HIV to the department so that we can know the status of TB and HIV and take further action where required in terms of policy, etc. And from that, we had a summit where commitments were made, and these commitments were emanating from the recommendations that were made. One of them being that, as I've mentioned, but then we needed a tool for the industry to start reporting on TB and HIV, and that is when the DMR 164 reporting form was developed. And of course, there had to be a committee that looks after TB and HIV and advise on that. And that is when MITHEC was established in 2012. And once the form was completed, it had to be sent out there to the industry for them to start reporting. And an instruction was sent out by the Chief Inspector of Mines so that mines can start reporting. And from then to date, mines started reporting on that form. And we have reviewed to accommodate the 1990 End TB strategy, where we have also included explanatory notes for the mining industry to assist in completing these forms. And mines have continued to report on the form. Now, in 2014, we had TB milestones covering TB and HIV, which indicated that by 2024, the TB incidence rate should be at or below the national TB incident rate. And at that time, the national TB incidence rate was around 850 per 100,000. And that for the industry was above 1,000. So we're trying to get below that, or to match that up or get below that. And you'll see with oncoming slides that we have done quite well. And in terms of TB on HIV, we had set the bar a bit higher. Although there is a 1990 strategy, we had said that at 100% of employees should be offered HIV counseling and testing annually, with all eligible employees linked to an antiretroviral therapy program. Now, these are the submission trends since inception of the DMR 164 reporting form. You can see we started only with 457 mines reporting, and gradually, as time went on and with workshopping on the form, more mines that were reporting. And by 2020, we had about 775 mines reporting. Now, the form also looks at issues of compliance per commodity or per mine for that matter, but we break it down into commodities. And we look at measures such as an integrated TB and HIV policy, integrated HIV and TB program, and the budget, and the monitoring and evaluation. So in terms of dividing it into commodities, we'll note that, let me just start with the totals. You will note that in terms of policies, in all nationally, at least 91% or 92% of mines are complying in terms of having an integrated policy. And then of worry is that the budget for TB and HIV programs is quite low at 46.7%. And you will see with the different commodities how they are doing there. I will not go individually into that. Now, looking at the trends of TB data elements, starting from inception up to 2020, with focus points being on screening for TB, diagnosis, and TB treatment, we'll note that the screening has improved from 72.9% to 93.3%, which at one time was quite high at 97%. but obviously the effects of COVID have had a knockdown effect on the screening because medical surveillance was also affected. In terms of diagnosing for TB, at first, when we started, 1.2% of the employees were diagnosed with TB, and with programs being put in place to improve on the management of TB, one can see that TB, people diagnosed with TB, the percentage went down to ultimately 0.3%. And in 2020, it was at a slight increase at 0.4%. And at least about more than 90% of the people who are diagnosed are put on TB treatment. Now, looking at the overall picture of TB programs in the mining industry, where the total sample size for the whole mining industry for 2020 was at 482,000. And from that sample size, I've already mentioned the screening was at 93.3%, and those diagnosed at 0.4%, and those on treatment at 97%. The core infection rate was at 40.5%. Looking at the trends for TB screening, it also seen we were aiming for 90% TB screening at least, in line with the 1990 strategy. And we were falling short from the beginning at 80, but with time we went on and even surpassed the 90%, and we are still surpassing the 90% despite the disturbance by COVID.
Dr. Mokoboto.
Looking at the TB incidence and the trends thereof,
Dr.
as indicated.
We are
sorry?
now giving you 5 minutes to wrap up quickly.
Okay.
Thank you very much.
Thank you. Thank you. I'll be wrapping up. TB incidence, as you can see, has gone down gradually. And at the last data that received has indicated that we are now at 312 per 100,000 population. Now, these are the trends I'll focus only on for the HIV data elements. I think the other slides that are coming will talk more to this because this is a bit busy. Now, this is the overall HIV program in all mines with the same sample of people. The cancelled people overall 73.5%, and those that tested 59%, and the percentage of positive people at 5%. And the trends thereof shows that the cancelling has gone up gradually from 54% to where we are now at 73.5%. And the positive rates, we've moved down to 9-10% to where we are at 5.1%. Meaning that not many people are hopefully getting positive. In a way of conclusion, I would like to say that MITHEC has been supporting the TB and HIV response in the South African mining industry by monitoring TB screening, HIV counseling and testing of mine workers through the DMR 164 form, promoting INH prophylaxis for all HIV positive population and X- with silicosis, getting guidelines on HIV management, addressing screening TB patients for HIV, guidelines on TB management, developing integrated policies, partaking in all these commemorations for the World AIDS Day and the TB Day, and also keeping abreast with the WHO and Department of Health initiatives, having milestones for the industry towards achieving certain goals, and collaborating with relevant stakeholders, supporting the initiatives to promote TB and HIV prevention. It is said that none of us is as smart as all of us, and that's Ken Blanchard who said that. So it's clear that through partnership, we can achieve a lot.
Thank you.
With that, ladies and gentlemen, I would like to thank you, and that's all I had for you.
Thank you
very much.
Thank you. Thank you very much, Dr. Dipalisa. That was a riveting presentation. And it all goes back to show us, again, about the importance of our information systems. Now, without much ado, because we are running 20 minutes late, I would like to introduce Dr. Tutula Balfour. And Dr. Tutula Balfour will be presenting to us virtually. If you could just maybe show your face so that we can all see you. She is Head of Health at the Mineral Council of South Africa and an employer convener at the Mine Health and Safety Council Board, who has served at the Mine Health and Safety Council Health Advisory Committees and various other entities, including SANEX, Private Sector Forum. Her presentation will be on the South African mining update on COVID-19. So are we there, Dr. Tutula? Oh, there you are. Wonderful. Welcome. Welcome very much. Let you give the opportunity to grace you with your presentation. Thank you very much. Grace us, actually.
Thank you very much, Program Director. Very good morning to our Chief Inspector of Mines, to all the principals from organized labor, employers, and the state, and those from our partners, and everyone in the room. It's a pity one is not in Cullinan. I would like to indicate that I'm actually presenting on behalf of Dr. Baloyi, who unfortunately could not be with us. And it's a real pity because he has put together an excellent presentation for you. And I'm sure you would have loved to present it himself. But let me go off camera. I hope you can see the presentation.
Yes, we can see it. Thank you very much.
Can you see the presentation?
Yes, we can see it. Thank you very much. You can proceed.
Yes, we can.
Okay, thank you. Dr. Baloyi was tasked to talk about the impact of COVID-19 on the TB burden. And okay, I was just struggling with moving it along. Just to highlight, globally what is happening, as we have heard, COVID-19 has had a very negative impact on all health services due to the lockdowns that countries needed to implement. We saw that in Dr. Mvusi's presentation. We had the number of people that were newly diagnosed, and I think that's the most critical thing, that people did not have access to services, and therefore there was a drop of about 20% in the number of people that were diagnosed with TB from 2019 to 2020. And of those, that the 1.3 million decline, it was in 16 countries that are mainly in Asia, but actually these countries are also part of the group of countries that have the highest number of TB cases, and South Africa is included. And so I'm sure it's more a question of the numbers. India has 1 billion people, Indonesia about 300 million, but we heard that even in South Africa there was a decline. So as much as there was a decline in the number of people that were diagnosed, there was an increase in the number of deaths from TB of about 10%, which actually showed a regression in performance on TB, which took us to 2019. So it's just illustrating that there was a major impact from COVID-19 on TB. Why TB? Well, TB Day. As we all know, this is a day when Dr. Robert Koch discovered the Mycobacterium TB. And we also always need to remember that TB used to kill 1 in every 7 people in the United States and Europe. And in fact, TB is fairly new to South Africa, where it was introduced by mainly Europeans trying to recover in the sunny, Cape Province in South Africa, and that's how it was first introduced. This was beyond the mining, the Cornwall miners who introduced it directly to the mines. But one is just trying to illustrate the fact that TB was there in other countries and it was eliminated, almost eliminated. And so that should be something that we must also aim for. And if you look at TB in South Africa, it is mainly a disease of people also low socioeconomic status, besides the HIV, if I can take that out. So TB is a disease of poverty, and it's therefore still possible for us to eliminate TB if we address those, the causes of TB. These are quotations from the WHO Global TB Report for 2021, and it notes that progress against TB has long been inadequate to reach the target of elimination by 2030, and South Africa is one of those countries, where our progress has not been adequate. But before the COVID pandemic, we were making some progress in diagnosing and treating people and in deaths. And therefore, the COVID pandemic reversed what was a slow progress towards reaching our targets. But I think we must also take away the fact that the response thus far had not been adequate. And therefore, we really need to have a kickstart and upskill or sort of raise our response to the TB pandemic. These are the remarks from the WHO Director General, where I think the most important was that it's also the struggle to end poverty, inequity, unsafe housing, discrimination and stigma, and to extend social protection and universal health coverage. This is what he was saying when he was saying that this is the struggle to end TB. So if we look at all of these things, then we will be closer to eliminating TB. These are just some of the performance milestones for the world regarding at the top World End TB strategy. If you look at the target is the whole circle, and the red is how far we are. So, for instance, on our target on reducing the TB incidence rate, we wanted to achieve 20%. We have only achieved 11%. This is from 2015 to 2020. And on the number of deaths, we wanted to reduce by 35%. We only achieved 9.2%. That's a huge difference in what we aim to do. And the percentage of people facing catastrophic costs from TB, we wanted that no person must face any catastrophic costs from TB. And we only managed that for 47% of people. So just illustrating that there is still a huge gap for us to fill if we are to achieve our targets. The other, at the bottom, is the UN high-level meeting on TB treatment targets. And again, you can see there, the best that we do is about half, which is the people who are on TB treatment. And on the others, we are far less than half. And on MDR TB for children, we are a woeful 11% in terms of the targets that we were to achieve. On the UN high-level meeting targets of TB prevention treatment targets, the only one where we did well was people living with HIV, where we had a target of 6 million people to treat, and we treated 7.2 million. On the rest, again, we are falling far short. And the same with funding targets, and maybe for this meeting, which is on investing in TB, this is the important slide right at the bottom on the right, where we had a target of 13 billion annually to invest, but we only managed to invest 5.3 billion, less than half of what we intended. And again, on TB research, it was 2 billion, but we achieved about 900 million. So all in all, we are not achieving what we had set out to do. I will not take time on this slide just to point out this is the statistics for these are the statistics for the South African mining industry regarding COVID-19. And we, from the beginning of the epidemic, we recorded 63,707 cases with, unfortunately, 749 deaths. This is usually available and circulated fairly widely, and is also available on our website, which is why I will not spend too much time on it. On the vaccination, just to say that we are now on 75% of our employees having had at least one dose of the COVID-19 vaccine, and that takes us to 67% who are fully vaccinated. And maybe one needs to commend the companies for doing what was probably not an easy job, although this is still short of the target, but at least it is quite close to what we wanted. In closing, is to say that the COVID-19 pandemic has reversed years of progress, in providing essential TB services and reducing the TB burden. And we now need to get back on track if we are to achieve our targets of eliminating TB. It is also sobering to reflect that during the 18 months that we've had the COVID-19 pandemic and we're all focused on the pandemic, we, in that time, lost about 88,754 people to COVID, but at the same time, there were about 90,500 South Africans who died from TB. So we should not, risk focusing on COVID-19 at the expense of TB. And now that COVID-19 really is, if I can put it like that, on the way out, it's no longer as devastating as it used to be. I think we need to make sure that we focus on that we have always had as a problem, which is TB. So COVID-19 pandemic has proved that health systems can make drastic changes when the need arises, and it is the same that we need to do for TB. So the resources that we marshaled for TB, for COVID-19, we need to make sure that we do the same for TB. I will end with a quotation from Dr. Teresa Cassava, who is the director of the WHO Global TB Program. And she says, we have before us the opportunity to save the millions of lives, to preserve resources, and to demonstrate the success of efforts to end TB, despite crises that come our way. We must keep the momentum going to stop the spread of this preventable and curable disease and reach those affected with the care they need. And she concludes by saying, we are running out of time. The clock is ticking. It's time for urgent action to end TB. So on that note, colleagues, I would like to thank Dr. Baloyi for his presentation, and it's been my pleasure to share it with you. Thank you very much.
Thank you very much, Dr. Tutula Balfour. Thanks a lot. There is only one point that I also want to remind us on, which are the Sustainable Development Goals of TB, and which one of them is featuring on point 3 is diabetes. We tend to forget that diabetes in itself reduces an individual's immunity, and those people are actually prone to TB. We also need to intensify our alcohol and drug awareness amongst the people to ensure that they have proper nutrition, they go for counseling, and that they're not prone to TB. As Dr. Tutula has alluded, also poverty plays a huge role. So we actually have a lot of work to do on our side. Ladies and gentlemen, it is time for our tea break, and it's going to be a 15-minute tea break from 11 o'clock until 11:15 For those who have checked in, we request you please to check out, and then we'll meet at exactly 11:15. And for our virtual attendees, 15 minutes. I hope you'll grab a cup of coffee and enjoy it in the meantime. Thank you very much.
Actually very, very important, not just for MHSC as an entity, but for the entire SA mining industry as a whole. We know how significant mining contributes to the economy. So as long as our workforce is safe and we continue promoting awareness, focusing on TB today, we want to ensure that mining continues to contribute to the SA economy. So it is very, very important in continuing the fight against TB and HIV.
The theme this year talks to ending TB in the South African mining industry. And what initiatives do you think Tripartite stakeholders can play towards ensuring the end of TB in the industry?
Okay, thanks, Masana. Very good question. So in line with our mandate, MHSC needs to review legislation and develop any policies or regulations that can assist the sector. In addition to that, we need to conduct research and also promote a culture of health and safety. So our initiatives are based directly on that mandate. Today is a good example of us promoting a culture of health and safety, making sure that we reach as many stakeholders as possible in ensuring that our initiatives are known and we have buy-in. Going forward, we'll continue with conducting cutting-edge research that will contribute to the sector and also develop legislation and regulations and policies that will assist the sector.
Last question for you before I let you go.
Okay.
Are you able to just give me the research that the Mine Health and Safety Council has conducted, specifically looking into or zooming onto TB?
Okay,
Are you able to share with us?
Yeah,
And
yeah.
also-
I will share. Yeah, I will share just the very, very latest, colleagues. We can't run away from the fact we are still in the COVID pandemic. Things have improved. But a very important research question was, what is the impact on TB resulting from COVID-19? So we are very excited about that project. We are busy finalizing a scope now and in terms of reference for us to conduct this research. Within the next month, we want to get going so that, as we fight TB, we also consider the impact of COVID-19. I think that will really assist us in continuing our journey and our milestones, from the summits and in assisting the sector.
Great.
So we're looking forward to that, yeah.
Thank you so much, Mr. Ngube.
All right.
Thank you for your time.
Thanks, Masanda.
Thank
Thanks.
you.
Good question.
And now
Thanks.
we're going to call Mr. Charles Mkumane. As you may know, the Mine Health and Safety Council has a tripartite structure which involves organized labor, state and employers. And now we have Mr. Charles Mkumane, but I'd like for him to introduce himself much better than I am doing. Sir, please introduce yourself.
My name is Charles Mkumane. I represent organized labor, which includes AMCU, NUM, Solidarity, UWASA, and I am the convener in the committee that deals with TB and HIV in the mining industry.
Thank you so much. Mr. Mkumane, please tell us, in your view, how important is this day in the mining industry?
I think it is important because we need to look back at how far we've gone, going forward, what are the challenges, what are the gaps, and then we deal with those things. And then I think when stakeholders meet together, we are able to help each other chart the way forward. I think in that regard, this is very excellent forum because we want to say that TB is the #1 enemy. So this is very important, this forum.
And thank you so much for that. And what role do you think organized labor can play in ensuring that we end TB in the SAMI? What activities, initiatives do you think we could put in place to end TB in the SAMI?
I think for us as organized labor, we need to push more in terms of making companies to commit themselves in terms of dealing with the TB in the mining industry. And other areas of the companies must also, continue to deal with issues of poverty, living conditions of mine workers. Because you realize that mine workers have now moved into informal settlement. Since the mines, we engaged with mines to allow mine workers to live in the compounds and outside the compound. So we need to engage forward the companies to improve conditions of living.
Okay, great. Thank you so much, Mr. Mkumane. I appreciate your time. And we will engage later on other matters that you have raised, but thank you so much for joining us. And now I have Mr. Nico
Yes, and I think, you know, I think it's best that I do, the person does the introduction himself. Please tell us who you are, sir.
Masanda, thank you. I'm Nico van Rooyen. I'm working full-time for the union OASA, and I also assist on the council meetings as HRAC, which is not existing anymore, and I was at SIMRAC and MRAC.
Great. Thank you so much, and thanks for joining us today. Most important for me is you've seen how we have proceeded since the morning up until now with today's program. And what stands out for you about today so far?
Masanda, yeah, I'm quite not very happy regarding the attendance. I think we could have supported the attendance more, and because this is for our employees, of our members and the employees. So I think we should put a better effort in, not from our side, from the outside companies to assist us in achieving our goals.
Oh, that's great. And what role do you think, given where you're coming from in terms of your background, what role do you think organized labor can play in ending TB in the South African mining industry?
Masanda, from my side, I think if we can get our members to be tested and to declare their status and live with their status, and they should know that TB is curable if they use the medicine, I think then we would have achieved a lot.
Okay, and what do you think, what future initiatives you think we could actually be tapping into as the industry as a whole, collectively? Because remember, we are a tripartite structure. What can we collectively do as the industry in terms of ending TB?
Wanda, if I look at what we did in the covert, I think we can tap into the covert system, because we in the mining industry, you should know, we achieved a lot, and we are in most places at 90% vaccinated. So I think we must use that system to suit us as well in the TB campaign.
Nico, thank you so much for your time, and thanks for joining us today at this event.
Thanks a million.
Thank you so much. And now we have Letitia. Yes, we have Letitia from Ukozi, but Letitia, please introduce yourself to our audience as to who you are, but also touch on Ukozi.
That's fine. I'm Letitia van der Berg. I'm the Group Health and Safety Manager for AfriMat, but I also wear a hat of a SPASA member for small-scale mining, and then also the chairperson for the Ukozi RTF, the chairperson for small-scale mining in Gauteng.
Okay, great. And today's proceedings, what's your take on it so far?
So far, the collaboration with Ukozi has been magnificent. We've reached 87 mining houses across South Africa, not just in Gauteng, and the stats are scary. Although small-scale mining has low TB cases, we are here for zero harm. So we are hoping for future collaborations, not just with the council, but with other mining houses as well.
Great. Letitia, you mentioned the company that you come from. And if I were to specifically zoom into that, what initiatives in your company are you putting in place to ensure that we end TB?
We have a very fractured health structure within AfriMat, but we pull it together through my department, where we monthly have our awareness campaigns, and we roll it out across South Africa within AfriMat. So we go mostly with national health initiatives, but also through the Mine Health and Safety Council and Minerals Council initiatives, which includes TB, diabetes, your general health management, and HIV and TB.
Okay, last question for you. Tell us a little bit about Ukozi, RTF. RTF, which actually stands for Regional Tripartite Forum, and we tend to use the acronyms a lot, and we may lose a few people there.
So Ukozi fits into the Mine Health and Safety Council platform. That is where it's born from. It started within ASPASA, but then ASPASA cannot run it, and therefore they start asking members to partake in the process. So Ukozi consists of all the small-scale mining in Gauteng, and there is a steercom which consists of the DMRE, the Mine Health and Safety Council, organized labor and employers. And that steercom then determines what we're going to focus on, and then we meet quarterly to share any health and safety information, new practices, new forms, any legislation in that platform.
And what would be your highlights from the RTF, or your achievements, maybe that you may want to brag about to other RTFs out there?
Well, from attendees from 5 to 73, our last one we had virtual and hybrid, there were 73 attendees. And also knowing that we've helped one-man-owned small industry members. The DMR phones me as a chairperson and asks to help those individuals. So you know you are helping to creating a safe and healthy environment.
Letitia, thank you so much, and thank you for hosting us as the Mine Health and Safety Council in ensuring that we have a successful event.
Thank you very much.
Thank you so much.
Thanks.
And now we have Mr. Mandla Mahlangu. Sir, how are you?
I'm good, and how are you?
I'm good, thank you. I would like you to do a better job than I have of introducing yourself.
Oh, my name is Mandla Mahlangu. I'm project manager for Masoyise Health Program, which is a mineral council-led initiative on health response, especially on TB and HIV, occupational lung disease, and NCDs.
Okay. You're mentioning Masoyise. What is the importance of Masoyise being part of this event, this Mine Health and Safety Council commemoration?
Masoyise Health Program actually is just like the Department of Health being the cornerstone of TB and HIV. So Masoyise is also playing that role in the mining industry.
Okay.
It started in 2016 as Masoyise ETB, but then now we started including HIV, occupational lung diseases, and non-communicable diseases. So
Okay.
this is what we are doing now. And yeah, we help all the mines. Now the program is now a wellness program, actually, instead of just a TB program.
Okay.
We encompassing all the wellness issues that are important in the health of the miners.
Okay.
Yeah.
And what highlights can you maybe share with us with regards to the achievements of the great milestones that Masoyise has reached?
You know, especially on TB, the target was that we wanted to have infection rate that is lower than that of the country. So now, from our 2020 annual report, we reported 220 per 100,000 employees who have been screened for TB. So this is an achievement because we are now, you know, moving to zero new infections on TB.
Okay.
Yeah.
And in terms of the future initiatives that Masoyise could be playing or doing for the industry, are you able to maybe let us in on that as to looking into the future? What are the initiatives?
You know, I actually advocating for TB contact tracing.
Okay.
Because it helps us to eliminate TB. So if maybe all companies can embark on TB contact tracing, that will help a lot. Because if maybe an employee is found to be TB infected in the workplace, then we go to their workplaces in communities.
Sure.
Then we can be able to, you know, reach out to those people that have not had an opportunity to be screened.
Okay.
Then we go to them in their communities, in the comfort of their houses. Then, I mean, we can reach as much people, and we can be able to eliminate this deadly disease.
Okay, great.
Yeah.
Thank you so much for your time, and thanks for joining us in this World TB Day commemoration.
Thank you very
for your
much,
time.
Sandra. Thank you.
And thank you so much. We will definitely be interviewing more people later on, and stay tuned. I wanted tripartite stakeholders. And next to me, I have Mr. David Msiza, but I think he will do a better job of introducing himself than I can.
No, thank you, Ms. Peters, and good day. My name is David Msiza. I'm the Chief Inspector of Mines and also the Board Chairperson of the Mine Health and Safety Council.
Great, thank you so much. Mr. Msiza, can you please share with us the importance of the Mine Health and Safety Council commemorating World TB Day for the South African mining industry?
No, thank you, Masanda. I think that's an important question. I think as a sector, the sector has an unfortunate legacy of loss of life because of occupational health and safety and mine-related hazards and risks. One of the key things that was previously not focused on in the sector has been the health issues. In fact, there are more people who lose their lives because of health, more specifically because of TB, HIV, and AIDS, and recently because of COVID-19. So it's very important that we should come together and also review the progress that has been made in terms of the milestones that we've agreed upon. Previously, we came up with the milestones to improve on health and safety, but critically to ultimately achieve the goal of zero harm. So today's presentations, they will have seen that there's progressive trends that have been indicated by the colleagues, including Dr. Mokobot as well. However, we are not there, especially with TB. And if you look at pulmonary TB cases, I mean, 2010, there were more than 4,000 cases reported. They came down to 2,000 to 2020, but our goal is zero harm. So I think it's very important that we come together and say, we're here now. Our ultimate goal is zero harm. How do we make sure that we improve on that?
Thank you so much. Mr. Msiza, looking at the stats that have been shared by the various stakeholders, how close or how far do you think we are as the industry to achieve the goal of zero harm?
You know, I always say that, you know, that the numbers, they don't lie. But most importantly, the numbers represent human beings. You know, some of the most important values that we've agreed upon as a sector, it has been caring and dignity and respect for human life. You know, for us, it's very important that we appreciate that behind the numbers, there are human beings, also who are mine workers and their families as well. So there has been great initiatives and interventions that have been presented. I think they will assist us to continue in significant improvement. But for me, what is also important is that, you know, when the mining charter was introduced, we have pushed as the Mine Health and Safety Council that it must also have an element of health and safety. What was also important there is the living conditions of mine workers, because historically mine workers used to live in hostels, and that also make a huge impact on TB and HIV and AIDS. So the sector has gone a long way to improving on that. However, we can go further if we improve the living conditions of mine workers. In fact, earlier I made an example to say, if you drive to the eastern limb of the Bushveld complex, the platinum mines in Rustenburg, you will see that since some of the mines have introduced the accommodation schemes, their mines, some of the mine workers moved into informal settlement. That does not help in what we are to achieve in terms of TB and HIV and AIDS. So it's very important that we also look at that element. 24-hour life of a mine worker. What do they do when they are at home? If we are going to achieve this goal of zero harm and significant impact on TB.
Great. Last question for you. As the MHSC board chairperson, we are in a tripartite structure. What role do you think the tripartite structure or the representative can play in ensuring that we end TB in line with the theme for this year?
I think the role that we play, and I always refer back to the Mine Health and Safety Act. You know, when it was introduced in 1996, the forefront matter was to ensure that there's collaboration or tripartism. For us, it was very important that organized labor, business, state, we work together on health and safety. And since then, there's been significant reduction in the challenges that we've experienced. With the lowest fatalities, 2019, lowest diseases, injuries in 2020, a significant improvement on mitigating factors on COVID-19. So I think we just have to continuously collaborate and as through the Mine Health and Safety Council come up with impactful interventions that will ultimately ensure that we achieve the goals that we've set ourselves, which are also aligned to the NSP or the National Strategic Framework or Plan of the government.
Great. Mr. Msiza, thank you so much for your time and thanks for joining us.
It's a pleasure.
Great. Thank you so much to everyone watching, and back. I think we are now back into the program. Thank you.
To switch on his video so that we could see him. He is the Chief Executive Officer of SAPCOA and Head of Secretariat for Private Sector Forum. Further, he has a PhD. He is actually a PhD candidate in economics with the University of Cape Town. He's also a secured the Future Fellow, a joint program between Morehouse School of Medicine and National School of Public Health in Medical University of South Africa, developed by the United Nations to train African students on HIV/AIDS management and financing. The presentation that he's going to share with us is on the private sector campaign feedback. Welcome, Mr. Jikwana. Welcome to this venue and the podium, and the floor is yours. Please grace us with your presentation. Thank you very much. Can you please unmute on our behalf so that we can hear you?
Yeah, can you hear me now?
Yes. Thank you very much. You can share your presentation.
All right. No, Chair, there is no presentation. I'm just going to walk the team through the whole campaigns.
Thank you. You can proceed.
All right. I'm going to switch off my camera now. Once again, let me just follow, to the previous speakers, sending my apology for not being able to be there physically. There's quite a number of, of competing things that forced me to be here, which I shared with, with Flo and the team. Let me start, Chair, by just outlining to the team and everybody here what is SAPCOA, just in case there is people who do not know about SAPCOA. I will also just touch on the role that SAPCOA plays within the SANAC Private Sector Forum, and look at our role that we play within in terms of all the campaigns under SANAC. I'll make sure, Chair, that I wrap up all this within the 5 minutes, of the time allocated to me. SAPCOA was established more than 20 years ago as an organization that is responsible for coordinating the private sector response on HIV and AIDS. As we may all know, that back in the days, the response by government on HIV and AIDS, I would say it was kind of staggering to some extent. So private sector jumped in by providing antiretroviral therapy to the employees. This is mainly based on the fact that there is a clear understanding and a clear relationship between the state of health of employees and the economy. So given that direct relationship, there was a need for the employers in South Africa to provide therapy in order to save the economy. So SABCOA was established around that time to ensure that there is a proper coordination of private sector response. This is a member organization. What it means, then, program director, is that in our DNA, we live by our members, by ensuring that we can provide them with guidance around the interventions. In the SANAC private sector engagement strategy, which is the series of strategies that are developed by SANAC for the engagement with all the sectors, they recommended that SABCOA, must be a secretariat to the private sector forum. Some of the colleagues that are, in this forum, they may have heard the presentation that I once made regarding the private sector forum, but I'm going to repeat it once again. Private sector forum was launched by Deputy President on the 11th of June in 2021. As we all know, the coordination of, and the implementation of HIV and AIDS is based on a tripartite alliance, which is government, which is civil society, and which is private sector. We know what government has been doing through SANAC. We know the action which has, the civil society, it has been embarking upon. We don't know what private sector, it has been doing, despite the fact that everybody can talk about the history of implementing, these programs. The manner at which we've been working as a private sector, it has been very transactional, it has been very sporadic. So hence there was a call from SANAC to ensure that private sector can be organized so that it can fulfill and swell its ranks within SANAC and facilitate the implementation of the national strategic plan on HIV and AIDS and TB. So when the forum was launched on the 11th of June last year, this was a product of an engagement that the SABCOA, together with the presidency, the Department of Health, and SANAC embarked upon to consult all the different business formations. We consulted with BUSA, we consulted with BBC, we consulted with South African Informal Traders Association, we consulted with South African Waste Pickers Associations, we also engaged the Council for Medical Schemes. As such, with all these consultations in these different organizations, we nominated members who will sit in the private sector forum. So the composition right now of private sector forum is 24 members. There is 7 that are coming from BUSA, there is 7 that are coming from all the member organizations from BBC. There is 5 that are coming from Council for Medical Schemes, representing the insured and the schemes. There are 2 that are coming from the informal economy between SAITA and SAUPA. So our role is, as SABCOA within the private sector forum, is to play a secretariat role. That secretariat role, which means we facilitate this machine to move. If an audit doesn't move, it means that our role as SABCOA will failed. So this is the partnership and the role that we play in ensuring that private sector forum, it achieves its objective of being a coordinator for fighting all the epidemics in the private sector. That is HIV, AIDS, TB, and STI, that is gender-based violence, and that is, COVID-19. We launched, after the launch of, the forum, we developed a strategy. That strategy, it focused amongst other things. I would just mention two, which I believe they are linked to this discussion and the people around. What we know is that there is a lot of data that is in the private sector, which we need a central point at which that data can be collected. This is the data that we know it is probably sitting amongst the various wellness service providers that are contracted. What it then means is that we need to make sure that we can mirror all the different data sets that are used. These are the data sets that are used by Council for Medical Schemes, which I'm definitely sure this is a good data that we can get in there, because schemes are mandated through the regulations by CMS to collect this information. Dr. Balfour mentioned, and Dr. Mkono, the IDMR 64. We need to also to pull in the data that that is collected through that process. Program director mentioned the non-communicable disease. It is important that we can collect also that that data on non-communicable disease. And the last one is this country has got a responsibility in terms of the treaties that are signed. So this data is reported through ILO. We've got to to bring all these 4 data sets into one. This is now a requirement in terms of our relationship within SANAC, that when this data is collected, it's going to be collected and assembled through SABCOA. And we have to report to the SANAC Nerve Center. By doing so, we are able then now to say what is the rate, to understand the rate of infection within the private sector in general. Otherwise, right now, nobody knows. The numbers that you see in there, these are the numbers that are reported by SANAC through its interactions. The second one is the development of M&E framework. As I've said, we've developed this strategy.
Mr. Chigwana, can we kindly give you just a few minutes to summarize? I will give you 3 minutes to summarize. Thank you very much.
All right. Okay, I'll run, Chair. We need to develop the M&E framework. That M&E framework, it has to be discussed with all the sectors. As part of the campaigns on TB, SABCOA sits in the organizing committees of all the major, the events, the checking pillar, events, which are through the SANAC. We participated fully, in the preparations and the planning of World TB Day. There are 3 things that, that came up, in our engagement. One, it was the request, by that private sector must contribute towards the legacy project. The second one, it was the request, for the track that will be used for the door-to-door campaigns and meeting with all the TB ambassadors in the province. The third one, it was the digital X-rays and with gene experts. And the fourth one was around a government to host us for the engagement with with Deputy President. Chairperson, let me run through the last one. It is important to, for the team to realize that Deputy President has started with the engagements in all the provinces. The Northern Cape was the 4th one, where he engages with civil society, that is the faith-based organization and the traditional healers. So, this we added, in this schedule that he must include the private sector. So we had the engagement, on the 23rd with the private sector, a program which was led by Dr. Dipalisa, which she did, a fantastic job. Private sector was represented by Dr. Balfour. Something that came out of that engagement was a pledge which Deputy President indicated. said the Ikapa mine needs to drive. One was that there is a target of screening and testing 25,000 people in 3 months in Northern Cape. That's the responsibility. We've got to do as private sector. That
Mr.
was given
Chikwana,
also to the mine.
unfortunately, we'll have to let you go. But thank you very much for the presentation. If you could just maybe write us, just a detailed note that we can send to the attendees, both virtually and physically, especially on these pressing matters. And you are actually putting out a very important point across all of us that we need to work together and have information systems all over. There's no point if the private sector has their own information and the state doesn't have any information and we are unable to get the rates. So if you could put that down for us and ensure that as part of the training that we're going to go on ahead, together with the Mine Health and Safety Council and together with the Mineral Council, these matters are addressed in great detail in the platform. Thank you very much, Mr. Chikwana, for the enlightenment and the wonderful speech. Our next presenter is Ms. Letitia van der Berg. She is here in person. She is Head of Health and Safety of Afrimet Mine, a member of Aggregate and Sand Producers Association of South Africa, the chairperson of the Gauteng Ukhozi RTF, and a member of the Gauteng Regional Women in Mining Committee. I just need to get her details. Women in mining? Yeah. Presentation is basically on Gauteng Ukhozi feedback on TB campaigns. Welcome, Ms. Letitia. The floor is yours.
Am I audible? Thank you. Just observing protocols of the physical attendees and also the online attendees, and a very special thank you to my small-scale mining employers today. You might see empty chairs and think, not a good outcome, but I hope my presentation will change your mind. And we are here today because, or I am here today because of a sincere interest in the well-being, the overall well-being of the employee. And if we can all have that starting point, we can go a long, long way. And I also chose my career based on that sincere interest in the well-being of an individual. And in the mining fraternity, when I started in 1998, I've grown with the DMR, I've grown with the council, I've grown with small-scale mining. We've come a long, long way. Thanks, Lester. And you can go to the next one. So I have to accolade my steercom of Ukhozi, the regional tripartite, which are those individuals, and the DMR is helping us to drive this. And if that was not the case, we would not have made a success of it. So thank you very much, Mr. Masiza, and the entire DMR, Mr. Mpo, for always sending well representation from the DMR and bringing the challenges to us from a Gauteng perspective. Thank you. Next slide. So Ukhozi RTF small-scale mining. So yes, we have a resource problem, but also understand that we do know how to manage that resource shortage. We might not have a budget specifically for HIV and TB, but it's within our occupational hygiene and health budget. And we, on each clinic visit, there is a little bit of HIV, a little bit of TB, and a little bit of chronic health management. And we multitask. We don't just do, the manager is not just the manager. He's at times the doctor, contacting his employee, finding out, how are you doing today? We haven't seen you in a while. Is everything okay? That comes from the operation, from the manager. The manager is sometimes the psychologist to find out during the COVID period, Are you still okay? Virtually, we don't see you anymore, but are you doing well? Then the geographical spread. Yes, it's a huge challenge. But I will show you today how we close that by having just a few key people here today. We've reached quite a few small-scale mines already and making a change like that. Yes, economic constraints. One of my mentors said, to bring my mind up to speed, we sell a product that's equal to a loaf of bread. I can actually say equal to a liter of petrol. Okay. So don't expect us to have an automated mobile clinic there every single day. We can't do it. But we find a solution within it economically. So we do try and fit whatever we have in our resource and also still comply to the same Mine Health and Safety Act like the large-scale mines. And then our statistics is manual. I would have wanted to present to you today how many TB tests that we do from the 11th of March up until today. But because of manual processes, I still have to wait 1 more week. Okay, so the mine knows who needs to be referred, but from an escalated Ukosi Steerkom member, I have to wait a little bit. And then our products. You could brush your teeth today because of us. You could decor with aggregates. You go home. We provide you with a safe home with all our products. And then you eat your vegetables and you make your vegetable patch because we do agricultural line and also fertilizers. That is the products we are producing, not diamonds and gold, which is also precious and beautiful, but we give something that's more closer to you and you can take it home. Thank you, Lester. So the Mine Health and Safety Ukosi Tripartite TB collaboration. The Ukosi platform or the RTF platforms is a central point where we can share information. And we did it very, very well in the past. And the more we can get the smaller mines that's not ASPASA members to come. And again, DMR, thank you. You've brought non-ASPASA members which are still present or attending our sessions. And that helps them considerably because they've got less resource than an AfriMat or AfriSam or a RAUMI. And then the tripartism. We get to know each other on a personal level, not getting buddies because the DMR inspector will stop you if you don't follow the rule, but we get to know each other and work better together. And then reaching a wider spectrum of the mining houses and communities. And then the collaboration. So the Mine Health and Safety Council approached me and we decided to do this collaboration. And I just want to say thank you very much for considering us because we might just have one TB case within AfriMat with 2,300 employees, but that one individual could have passed on the disease to multiple others, and we also strive for zero harm. So thank you very much that we as a AfriMat and the small-scale mining, although our TB cases is low, that we can also make a difference. Thank you, Lester. So this is just where we introduced to the small-scale mines a few photos of the Mine Health and Safety Council work that has taken place on the 11th of March, and where we then hooked the small-scale miners. Thanks for coming to come and fetch your TB, HIV, and COVID pamphlets because they got the resource for free, and 73 participants attended, 49 physically, and about 39 virtually. Thank you, Lester. So this is how we reached a bigger industry. So there's the mines just in alphabetical order. In Gauteng, we've reached 22 mines in 22 different communities. We've reached 66 other mining houses in other regions. And we've reached 87 mines altogether across South Africa just by this one connection points of the Ukosi RTF. And you can see collaboration. You work smart, not hard. And even the communities, yes, we don't have a mobile setup there to do TB screening, but our employees do take the information home and share it within their communities, and it does make a difference. Thank you, Lester. And here's just a few examples of the mines that collaborated with us and formally said they will feedback, which is AfriMat. And you can just flip through Labucon. That's one of the smaller small-scale mines. AfriSam, and then Raumix as well, partaking in the process. One more, Lester. Yeah, and Lafarge. Lafarge has got one dormant mine in the Vaal, but I also participated in other regions. And then, yes.
We have about 3 minutes.
That's my last slide. So, collaborating with the Corsia and Aspaza, please do it more. We are willing. We might not be able to give you fancy statistics, but we will be able to make a difference and impact at our mines. And we might not have the resources or the market, but we have resilience, passion, and heart with multiple talents. And again, thank you very much for giving us this opportunity. And we're looking forward to the next one. Thanks a lot.
Thank you very much, Ms. Letitia. And that shows a great initiative on behalf of what you guys have been doing. Now we are going to come to messages of support. I think we need them greatly in what we do. You know, support is quite an important thing to motivate the people to continue to work hard and find innovative ways to make a difference. We're going to first start with a message of support from Mr. Mutokozisi Zondi from the state. He's a Deputy Chief Inspector of Mines at the Department of Mineral Minings and Resources, and his responsibilities include the management of health and safety, pardon me, ladies and gentlemen. Those technical issues, I think we are used to. We do get them every time when we are, Vodacom disappears all the time. As I was saying, the management of health and safety in Limpopo, Mpumalanga, the Free State, and the Eastern Cape regional offices. He is also chairperson of the Commission of Engineers in June 2013 and a board member of the Mining Qualifications Authority and Mine Health and Safety Council. At the Mine Health and Safety Council, he chairs the Mining Regulatory Advisory Committee and the Mining Occupational Safety Advisory Committee. So welcome, Mr. Zondi. If you could just grace us with your presence on the podium. Thank you very much. The floor is yours.
Thank you very much, Program Director. And let me start by acknowledging all the leadership from organized labor, employers and business present here today, as well as state. The Manager and Safety Council Chairperson, under the leadership of Ubaba Msiza, and the board members that are present here today, the MHSC Executive Management and Staff, UKOZI, a Regional Tripartite Forum, under the leadership of Mr. van der Berg. Distinguished guests, ladies and gentlemen, good morning. Good morning. Melang, Sanbonan. As the program director has alluded that I'll be pledging a message of support on behalf of the state. And if you recall in the presentation that was made by Dr. Balfour, she highlighted that in the past 18 months, about 95,500 South Africans have died due to TB. And that was really a shocking number to me, that so many lives have been lost due to TB. And in spite of the fact that TB is curable if one takes the medication. And the Department of Health decided on the TB strategy, which is 90-90-90. And I must say that our sector is also aligned to the national TB strategy. And Dr. Mkoboto also highlighted that the mining sector has been facing dual epidemics, which is mainly TB and HIV, and lately we all know the challenge we have faced with regard to COVID-19. And it's important that the sector has an integrated approach in terms of the management of TB and HIV. And I must also stress that also this year's theme, which is Invest in Action to End TB, HIV, and COVID-19, I think also support the integrated management of TB and HIV. Dr. Mkoboto also shared with us that the screening has improved in the sector. I think she said it improved from 72% to about 99%, and I speak under correction. And secondly, that there has also been a decline in the TB incidence cases in the mining sector to about 312 cases per 100,000. And what I'd also like to stress is that it's important that all stakeholders they must work together in the elimination of TB, HIV, and lately COVID-19. And we have also seen quite a few good examples that were presented in the UKOSI RTF presentation by Ms. van der Berg. And on that note, ladies and gentlemen, thank you very much.
Thank you very much, Mr. Zondi. Our next message of support is going to be virtually presented by Mr. Nikisi Lisufi. He is the Senior Executive, Environmental Health and Legacies at the Mineral Council of South Africa. He served at the Department of Water Affairs and Forestry in various capacities, Deputy Director of Water Quality, Director of Water Resources Management, and Head of the Regional Office in the Free State. He will be representing the employers. Oh, there he is. Welcome very much, Mr. Nikisi, to the podium. Thank you very much for gracing us with your presence. The floor is yours.
Thank you, Program Director. I need to apologize again for not being able to be there in person, but I'm with you guys in spirit. So thanks to the Program Director, the Chief Inspector of Mines, the Chairperson of the Mine Health and Safety Council, the Acting CEO of the Mine Health and Safety Councils, principals from the employers, the state, and organized labor, and distinguished speakers and delegates, ladies and gentlemen. It is indeed an honor for me and a privilege for me to give this message on behalf of employers. I would like to congratulate the Mine Health and Safety Council for once again ensuring that we have a successful commemoration of World TB Day. And we do this in a collective effort. This year's event shows even greater collaboration and cooperation with the Mine Health and Safety Council, the UKOSI Gauteng Regional Tripartite Forum, Organized Labor, SAPCOA, ASPASA, Minerals Council, SAMDA, and Masoise, all making an input in the organization of this event. This is highly commendable, as we can only overcome this disease if we mount a united and a collective effort. As the speakers have alluded to, there's still a good reason for us to raise awareness on TB and to commit to greater action and investment to eliminate this disease. The Deputy President of South Africa, Mr. David Mabuza, led the national commemoration in the Francis Bath District Municipality in the Northern Cape. The mining industry was very visible in the commemoration as Kimberley Ekapa Mine hosted the event. It was heartening to hear how the mine counsels over 100% of its employees for HIV and screens 100% of them for TB, while more than 80% of its employees have had at least one dose of the COVID-19 vaccine. This is an exemplary mine that has met the industry's milestones on TB and HIV, and is well on its way to meet the Minerals Council target of fully vaccinating 80% of the employees. The Deputy President challenged the Northern Cape Premier to screen and test an additional 25,000 citizens within 3 months. He further requested that the private sector and mining companies in the Northern Cape to assist the Premier in this task. As a key stakeholder in that province, we will take up this challenge under the leadership of the provincial government and coordinate and facilitate mining companies to live up to their obligation. So to get back to today's event, we are gathered here to celebrate the mining industry's commemoration of World TB Day under the theme, Invest in Action to End TB, HIV and COVID-19 in the South African mining industry now. A big question to ask ourselves is, how far are we to ending this epidemic? I will start with our progress on COVID-19. As Dr. Baffa has indicated earlier on, we are on target to reach our 80% target as planned as the Minerals Council. However, we still think that there's still scope for people to be encouraged to vaccinate. According to statistics, 73.5% of employees in the industry have been cancelled for HIV in 2020. Although this is not yet 100% as per our milestones, we have been making progress over the years. Let us not be discouraged, but push on to achieve the 100% cancelling of employees this year. Even those that know their status should still be cancelled. Regarding TB, great strides have been made in reducing TB rates in the industry. Our milestones we aspire to are at or below the South African TB incident rate. Since 2016, the industry has achieved this target. We should, however, not think that our work is over. South Africa has a very high TB rate and is part of the 30 high-burden countries in the world, as Tutula has alluded earlier. We should thus aim to eliminate TB in our industry and achieve the healthy worker effect, which states that those who are employed have a better health than the unemployed. To achieve this higher target, we need to go back to the determinants of TB in mining. Those are exposure to silica dust, and HIV infection. On HIV infection, we have seen very good stories from companies that had very comprehensive HIV prevention and treatment programs, where employees were tested and treated.
Can we kindly give you 3 minutes to wrap up?
Thank you very much. Well, the industry had made huge investments in the TB treatment program. The Masoyise Health Program, our flagship program, is a flag bearer in the mining industry in terms of ensuring that our TB management program are focused and our wellness programs are effective. Other countries have almost been able to eliminate TB, and we should not be deferred from that dream. In the short term, we need to integrate our approach to disease management. This will not only benefit the recipients, our employees, but will also lead to more efficient utilization of resources. Program Director, ladies and gentlemen, we've heard today how much progress has been made in reducing TB. Let us take this to the next level. Thank you.
Thank you very much. Thank you very much for your words of encouragement. Our next message of support is coming from organized labor, Mr. Nico van Rooyen. He is present here with us. He's recognized from organized labor to be a sector manager of UASA for gold, diamond, platinum mines. He has previously served at the Human Resources Advisory Committee as well as MREC of the Mine Health and Safety Council. Welcome, Mr. Nico van Rooyen. The floor is yours.
Thank you, Madam Chair. I hope you realize that I'm here on behalf of 4 unions, so I will take 4 times the time I should have. On a lighter note, thank you. Master of Ceremonies, Mr. David Masiza, Chief Inspector of Mines, executives from the council, colleagues of organised labour, and all protocols reserved. Over the last 2 years, it became quite clear that an urgent pandemic shift is required from a reactive way of managing pandemics and tuberculosis to a proactive behavioral-based culture and attitude towards pandemics within the South African mining industry. Let me start off with one of the fundamental principles of health, and that is that healthcare is everybody's business. It would even go further to say that prevention of TB should be a way of living and a culture amongst all of us in the workplace. This event here today should not be deemed as a mere another show or as window dressing, but should represent proof that all involved do indeed regard health and safety as everybody's business. What we have experienced over the last 2 years and the way the mining industry handled the pandemic, from reactive strategies and attitudes towards behavioral-based proactive culture amongst management and employees within the industry, should be a guideline for handling health from now on. Critically important, the strategies emphasized here today, taking cognizance of what we have learned over the last 2 years, such as testing and taking part in an active medical program, with or without the fear of victimization, forms the basis for cultivating a sustainable risk management culture through the industry, empowering people to respond to activities appropriately and to enable them to predict, prevent, and control health from now on. Continuous risk management is an innovative approach in the managing of health for our people in the workplace. It further entails a shared visible process aimed at eliminating at-risk behavior, creating an enabled health climate to develop sustainable, non-discriminatory attitudes. Some of the other very important and key objects involved should be creating a risk competence within the entire workforce, installing visible felt leadership as a value, recognizing and rewarding voluntary testing behavior and persons being proactive, creating a more enabled environment by removing systems barriers to health behavior. Behavioral-based safety is the obvious next logical step in the process of continuous improvement and is an essential prerequisite for world-class performance. Health and safety should not only be about the reduction of incidents, injuries, and fatalities, but also about total eliminating it through proactive non-risk health behavior. It is also about the ability of management to influence and control the behavior of people, as we have learned through the COVID-19 pandemic. It is furthermore important to remember that health and safety can only be attained through teamwork and healthy employee relationships in the workplace. Total commitment, and most important, by changing the behavior of people to benefit themselves. This is essential because the finest systems and equipment cannot function effectively if not correctly applied and monitored. And the most vigilant strategies will fail if not supported by aligned health behavior and attitude. Ladies and gentlemen, tuberculosis have orphaned too many children, withered too many women, and they devastated too many families. And that is why we need many more initiatives such as this program within our industry. As we heard this morning, that TB have killed more people than COVID, so yeah. With the COVID pandemic, all of us lost our focus on TB, and it's time to refocus again. I want to close by quoting some words from our previous president, Mr. Nelson Mandela, and he once said, "My country is rich in minerals and gems that lie beneath its soil, but I have always known that its greatest wealth is its people, finer and truer than the finest diamonds." Behavioral-based safety is indeed about becoming true to real safety and health. I wish to pledge on behalf of UASA, the union, organized labor, and our members total commitment towards health and safety and towards the total elimination of discriminatory practices within the South African mining industry into the future. Let's all declare our status and make prevention our business, our culture, and a way of living. Thank you, Madam MC. I hope it's in time.
Thank you very much. You did really do an outstanding job of representing all the organized labors. There's so many, but thank you very much.
It's currently only 4 minutes.
Thank you, but now it is time to introduce the most important person in this room. You know, without him, I don't think we'll be sitting here today, because he provides guidance, a lot of guidance from the Mine Health and Safety Council. And through him, we have learned. Through him, he has brought us together in many different platforms to discuss ways and different ways of combating TB, HIV, COVID-19, even underground issues, you know. And every time we listen to him, we have a world full of knowledge. And his name is Mr. David Msiza. He is here to deliver the keynote address. He is the Chief Inspector and Chairperson of the Mine Health and Safety Council. His keynote address, I cannot shorten at all. He is the boss. No matter what I want to do, he is the boss. So the floor is yours, sir, and thank you for gracing us with your presence. Thank you. You're welcome.
I think it's also just short, just to briefly to make some few acknowledgements. Thank you, Program Director, for the great work that you are helping us with today. I think for me, I always say that it's important and it's always an honor to serve with people like you. By the way, it's not about me, it's about working together collectively, and all the milestones that have been demonstrated today by all the presentations and the interventions, it basically shows that collaboration is very important. One of the things that we've agreed upon as the sector is that we can compete on everything, but we can't compete on the health and safety of the minerals. And that's why we've reached some of the significant milestones that we've reached. And we should, I think we put ourselves, you know, some people will say, hey, you put yourself difficult goals. Mining is dirty, it's dangerous, and so forth. Will you ever achieve zero harm? I'm bullish. In other words, I'm confident that we will definitely reach that. So I would also want to further acknowledge the other principals and important stakeholders from organized labor, from business, from the state, from mine workers. And I always say that the most important people in this sector are the mine workers themselves. And for me personally, I'm really honored to serve with the other colleagues to ensure that their lives are safe in the sector. And I think for me it's also important that, but also the community, because they come from communities, they come from their families, they leave the home, some of them early in the morning. At one stage they didn't believe that they would come safe, back home, but I think we are getting there. For me, those are the most important things, people that we also have to really appreciate for the work that they are doing. The small-scale miners as well, and I'm glad, you've indicated that we have agreed through the Department of the Mine Health and Safety Council that we must also form the regional tripartite forums, but focus on small-scale miners, because the challenges that we might experience might be different from the bigger mines. And it's very important that we engage with yourselves and to understand how can we work together with yourselves to make sure that we can improve. And hence, today we brought that in commemoration to as well. But I also want to appreciate all the colleagues from our Mine Health and Safety Council, including MIFEC and MOHEC colleagues. You know, historically, the mining sector has an unfortunate legacy of loss of life. I mean, I remember before I started working in the mines more than 30 years ago, one of the things my parents, when I told them I want to go and work in the mines, they say, hey, will you come back alive? You know, because anyone believes that it's very unsafe to work in the mines. But I think through collaboration with the Mine Health and Safety Council, make sure that there's significant improvement, more specifically on the health matters, because there was no focus there as a sector. In this regard, I would like to really acknowledge the role that Dr. Ndelu, who has not been well, I hope I wish a speedy recovery, and both Dr. Mkobot and the other colleagues have been assisting us in terms of MIFEC and MOHEC. Now, if you look in the last 2 years, COVID had a huge impact on our economy now, in the society at large. Some of us who are very religious always pray and say that we are also blessed, grateful that we are still here, and we are here for a reason. And for me, and my colleagues, and for all of us, I think one of the reasons that it's very important that we must continuously serve our people. We are here, South Africans, we must continuously serve our people. It's very important for us. So the mining sector continuously plays a significant role in terms of the economy. You'll see in the last 2 years that the contribution in terms of the GDP has been significant, but because of mine workers, who also play a significant role. And we've agreed in the previous tripartite summits that it's important that we must have values, that we must aspire to. 3 of them, which I think are very important for me, are the issues of dignity, respect, and care. And when we say care, and we talk about it, we should not be only talking about it. We must live those values every day. It's very important that we live those values every day in this sector. I always say that as long as we are still having cases of TB, HIV, AIDS, loss of life, whether it's health or safety, COVID-19, we still have a long way to go to demonstrate as a sector. In the past two years, we have held both the TB and AIDS commemoration for the South African mining industry virtually under the strict COVID-19 restrictions. During this time, our industry, like many others, had to adjust the new normal, and we are grateful that with the opportunities that the technology provided, we were able to still realize our mandate of promoting health and safety of the mine employees. Today, with such significant progress that has been made in fighting COVID-19, nationally, in our sector, restrictions have been lifted, and we are able to once again gather with some of you physically here at the Cullinan Diamond Lodge, and with others joining us virtually. We gather to commemorate a sector, as a sector, the 2022 World TB Day, but observing COVID protocols as COVID still exists, as Dr. Balfour and the other colleagues have indicated. In terms of the background of the commemoration, the other colleagues have touched on it. The World TB Day is commemorated annually on the 24th of March, globally, by the United Nations member states, of which South Africa is part of. It is in recognition of the date in 1882 when Dr. Robert Koch announced the discovery of Mycobacterium TB, a bacterium which causes TB in its many forms. A decade later, the discovery has paved the way towards the diagnosis and cure of TB, and to an extent, quick response towards similar diseases such as COVID-19. During the 5th Occupational Health Dialogue hosted by the Mine Health and Safety Council, we had a presentation on the progress that the world and country has made in developing vaccines for this complex disease called TB. It has become evident that resourcing towards vaccine development in this area is rather important, and that more attention needs to be invested in TB as it has since been done towards COVID-19. And in this regard, I would also like to commend the sector, Dr. Balfour, when she was talking about the programs that the Minerals Council have been embarking upon, which are commendable, touched on where we are in terms of vaccination. I think she's indicated that we are currently at 75%. We've agreed that our goal is beyond 80% and working together with the sector. So I would like to commend the mines and the small mines and the employers in that matter. South Africa began commemorating World TB Day in 1996 after the formation of the National TB Control Program to support global and national efforts in raising further awareness on the impact of TB and to step up efforts to prevent, manage, and end the TB epidemic. The Council, or that is the Mine Health and Safety Council, has been hosting annual TB Day commemorations during the month of March. Ending TB is a shared effort that we embrace as the mining industry. Our commemoration as a sector follows the national one that was held in the Francis Barbs district, municipality in the Northern Cape, as Ntateli Suk has indicated, a district with a high TB within the province. Progress and the way forward. As alluded to earlier, the theme of the 2022 World TB Day commemoration for the SAMI is Invest in Action to End TB, HIV and COVID-19 in the mining sector now, and we must strive to save lives in alignment with the national and global theme. In terms of invest in action to end TB in the sector, which means decisively investing our resources, including finance, human and time, towards ending TB in the mining sector. The Deputy President, as Ntateli Suk has indicated, in his address at the National TB Commemoration campaigns in the Northern Cape, stressed that we cannot continue looking at these pandemics, TB and COVID-19 individually. We need an integrated approach in responding to them. Much as has been learned from both pandemics, it is crucial that as we respond to one, we do not neglect the other, as the other colleagues have indicated earlier. We are also aware of the devastating effects of TB, HIV co-infections in our industry as well. And it's important that HIV's response is not left behind. In terms of now, it emphasizes the fact that time is of essence in responding to pandemics. The World Health Organization statistics tells us that TB remains among the top 10 causes of death worldwide as well. I always say that every time we speak about numbers and we talk on the numbers, we must never lose sight that the numbers represent human lives, they represent mine workers, and also they are also representing their families. So when we come up with interventions, it's not only to drive down the numbers, but also to save lives of the mine workers in the communities that they are coming from. Our industry, despite many obstacles we continue to face in the plight of COVID-19 pandemic, has progressed relatively well in the milestones what we have set ourselves, as alluded by Dr. Mukoboto earlier on. Also touch on that, and Dr. Mukoboto also touched on the numbers. Where are we in terms of the trends? And as I've indicated as well, it's important that every time we talk about the number, we must remember that there's a human being behind that number, and there are communities and families as well. Please, let's also be aware of. And I think the other thing that I think Babu Chigwana touched on is making sure that we focus on and share information. Babu Chigwana, I fully concur with that sentiment, and let's collaborate with the Mine Health and Safety Council and the department, also engaged with Dr. Mukoboto, because we've agreed to the Minor Health and Safety Council that we should not only focus on occupational health, but we should also focus on other matters that affect the lives of the mine workers, including public health matters, including non-communicable diseases. In fact, we collect that information, we analyze that information, and Dr. Mukowoto and the occupational health section of the department, they are doing a great work of also converting that into rates. I think it's very important that as we move on, we must also focus on it, including as well, it's very important for me to highlight losses of lives because of natural and occupational health related matters. So let's share those information, where we are. Are we progressing or are we not progressing? Through collaborative efforts, we have made significant progress towards achieving our commitments as a sector. Since the establishment of the Mining Industry TB, HIV, AIDS Advisory Committee of the Council during December 2003, the committee continues to provide sound advice on one, policy related to the prevention and management of TB, HIV and AIDS. Two, advice on health research that of late has been conducted through the Center of Excellence. Thirdly, on the collection, processing and distribution on health data as collected via the DMRE 164. Dr. Mukowoto has also touched on it. And four, on the implementing of TB and HIV and AIDS initiatives from the Minor Health and Safety Tripartite Summits. This is all done through our tripartite stakeholders, and that I can emphasize that the role that we all play is very commendable, as well as strategic organizations, also our collaborations with SAPCOA and Masoise Health Program. In all this, we have not forgotten the small-scale mines. It is for this reason that this year we wanted to demonstrate our support and commitment to ending TB, HIV, and COVID-19, even in small-scale mines. Hence, in collaboration also with a regional tripartite forum, which consists of primarily small mines, as I highlighted before, the Gauteng Ukhozi tripartite. We trust through these partnerships, we are able to appreciate that the fight is enormous. However, together we can definitely win. As I move towards closure, as a sector, these are important aspects that we are aware of and are at the center of our responses to TB. We are also reminded that TB is also curable. We have said it in the previous two commemorations that we need to have an integrated approach in responding to TB, HIV/AIDS, and now COVID-19, and through the Minor Health and Safety Council. We continue to gather data on the impact of COVID-19, not only on TB and HIV programs, but to the health of persons with past and present TB, as well of those living with HIV. Finally, the goal is zero harm, as I highlighted earlier. That's our ultimate goal that we want to reach, and we believe that it's possible. It's really, really possible. You know, I was looking at the trends, especially on the health trend the other time. I mean, the mines used to report close to about 15,000 operational businesses. It came down to just about 2,000 in 2020. We are not where we should be, but we are moving on. The mines in the past used to report more than 800 fatalities. We are just now hovering between 60 and 70. That's one. Loss of life is not acceptable, but it clearly shows that with the collaboration between ourselves, we can achieve more. We'll be holding the Minor Health and Safety Tripartite Summit later on this year. I think it's very important that we come together as we came together today to reflect on the progress that we have made on the milestones and on the trends that we touched on earlier as well, but also come up with other effective measures, as the other speaker has highlighted earlier, to improve on TB and the other health-related matters, including safety. Now, the question was asked earlier on during the interview, what can we do more? For instance, some of the speakers have said, what further can we do more as the Minor Health and Safety Council and the sector to really improve on TB. I think one of the critical issues that we probably have to talk more during the summit is the living conditions of miners and their families, and obviously the communities around them. I've indicated that the mining sector, it continues commendably to make a huge contribution within the sector. But colleagues, some of the conditions that our mine workers are living under is appalling. It's very important that we improve on that. And I believe that if we improve on that, right, it will also make a huge impact on TB, HIV, and AIDS. And I must also commend the sector, because when the mining charter was introduced, the sector came up with programs to improve the living conditions of mine workers, including for those who are living in hostels and so forth, you know, to make sure that they're livable, they can live with their families, and they provided them financial provisions if they wanted their own homes. But there has been downside to it, and if you go to the major mining districts, including in the Rustenburg or the Platinum Belt, you can drive down the N4. You'll actually see that there's a lot of mine workers living in informal settlements. Those are not only people who are coming to the mines to look for work. Those are mine workers who are ensuring that there's significant contribution to the economy. And this is how they are living. And this is also affecting the issue of TB and AIDS. So I would like to implore on the employers and the mines to also look at this particular matter. If indeed we are saying we are living the values of caring, dignity, and also respecting of the life. So, without our program director, I hope I didn't chow most of your time.
Not at all. Not at all.
Thank you, colleagues, for your attention, and also once again, well done, colleagues. Thank you.
Thank you very much, Mr. David Msiza. You actually planted a seed, and then the roots went deeper and deeper, and the branches started to grow, meaning that there is a lot of work that we need to do. We need to go back and reflect and see the different innovations that we can do. You spoke about dignity, respect, and care. And ever since HIV has come to being, there's always been that stigma. And I believe that's the reason why people are afraid to come forth, to come forth. With COVID, when you used to sneeze before, we used to say, bless you. Now when you sneeze, we're like, ish, yeah, man, but we need to understand that we need to encourage our people to screen and test. No matter which situation we find ourselves in, we need to also treat them with respect. And thank you very much for alluding to the housing that our employees stay in. They come forth, but when you drive down, it shows you a state of poverty. And where there is poverty, thrives TB and HIV. And that is very, very true. Thank you for that one. And by the way, Robert Koch discovered TB in 1882, 3 centuries ago. You mean we can't eliminate it? We, in the 21st century, I believe we can make a huge difference and ensure that by 2030, according to the WHO and TB strategy, we actually eliminate TB completely. We owe it to ourselves. 3 centuries ago when it was discovered, today we owe it to ourselves and to our children and our children's children to end TB. Finally, but not finally, because our work is not done, I'm going to introduce Mr. Dumisani Dlamini virtually. Can he perhaps show himself up there? He is the Chief Financial Officer and the current Acting Chief Executive Officer of the Mine Health and Safety Council. And he's here to give us his closing remarks. I can't see you quite well. Can you hear us?
Yes, I can hear you, Program Director.
It's like you're hiding behind something.
Can you see me now?
Yes, we can see you now. Thank you very much. The floor is yours.
Thank you, Program Director, stakeholders who were part of the stakeholder briefing earlier today, our tripartite stakeholders, organized business, organized labor,
Mr.
state
Dlamini,
representatives.
Mr. Dlamini, can you
Yes.
please put on
Yes.
your video so that we can see you? And while you're talking, if you're comfortable to do that, I know some people prefer to basically switch off their video, but I think you can do all things at once.
Okay, no, thank you. Program Director, stakeholder who were part of the stakeholder briefing earlier today. Our tripartite stakeholders, organized business, organized labor, and state representatives, Mine Health and Safety Council strategic and research partners, MHSC board members, MHSC committee and office, our valuable employees from different mines, whom the commemoration was primarily about, colleagues joining us those joining us visually, and all those that are present as well. On behalf of MHSC and our partners for this commemoration, your Masoise Health Program, the South African Business Coalition on Health and AIDS, and the Gauteng Coast Regional Tripartite Forum, allow me to greet you all and thank you for being present with us up until the end of our 2022 World TB Day commemoration for the South African mining industry. We are deeply moved by your participation in this commemoration and the past ones the MHSC has held for South African mining industry. Thank you, Dr. Irene Mampa, for directing this meaningful and informative commemoration with so much ease and professionalism. Health and safety is our second nature as the mining industry. We are, for this reason, grateful to Cullinan Diamond Lodge for ensuring this aspect is taken care of. Thank you for taking us through the COVID-19 protocols and procedures to follow in case of an emergency. Unfortunately, TB is a deadly disease that continues to claim lives of people, including mining employees. We are grateful to Mr. Charles Mkumane for ensuring that we do not forget to honor the lives of those who we lost not only due to TB, but to HIV and the COVID-19. May their soul rest in peace, and may we continue to show support for people still fighting these pandemics. We would also like to convey our thanks to Ms. Florence Magamba, who on behalf of MHSC Mining Industry TB, HIV and AIDS Advisory Committee, MITEC, reminded us of the importance of continuing the fight against this deadly disease, for emphasizing the importance for this commemoration, as well as taking us through the theme for this year's event. It is true that we cannot manage what we cannot measure, and we continue to see the importance that data plays in forming a lot of our initiative in the SAMI and in the globe at large. When coming to pandemics, we are grateful, Dr. Lindiwe Mvusi, Dr. Dipalese Mokoboto, Missy Peleng, Mohorosi, and also Dr. Balfour for sharing the statistics as collected by various entities on TB, HIV, AIDS, and COVID-19. It is truly important to be able to monitor our progress and be able to make informed decisions. It is the data like this that also assist Mine Health and Safety Council in conducting research
and in advising the Minister on health of employees. The national campaign on TB have been greatly successful, and we are grateful to have been part of them. Thank you, Mr. Siawanga Chibwana, for sharing with us feedback on campaigns and for emphasizing on how our industry plays and can continue to play an important role in the TB and HIV agenda. To the Gauteng Ukhozi RTF team, it is encouraging to see the work that the small mines are doing to prevent and manage TB and other diseases in the mine. Thank you to the Gauteng Ukhozi RTF chairperson, Ms. Letitia van der Berg, for reflecting on the importance of regional tripartite forums, and thank you for the feedback on the awareness campaigns by the mines. The Mine Health and Safety Council remains committed to initiating and supporting the industry initiative that aim to improve the health and safety of employees. Thank you also to our tripartite stakeholders, which are the state, the employers, and organized labor representatives for the words of encouragement. We are grateful for the continued commitment in eradicating these diseases and in walking the talk. You continue to prove that together we can achieve more. Thank you to the chairperson of the board, Mr. Msiza, for the keynote address. Ladies and gentlemen, we've been reminded that it's not only our industry that has not been able to meet set target in preventing and eliminating TB nationally and globally. As well, progress has been hampered more so by the COVID-19 pandemic. We cannot focus on the pandemic individually. We were reminded that we need an integrated approach in responding to the pandemics, and that we need to continue practicing basics. Thank you especially to our partners for this event, Masoise Health Program, SABCO, and Gauteng Ukhozi RTF. Together, colleagues, we can continue to achieve much. Please do reach out to MHSC that we collaborate in future endeavors to improve health and safety in our mines. These are in environments that mining employees spend most of their days at, and we need to ensure that their health and safety is not compromised. It is possible, colleagues. Lastly, a heartfelt thank you to you all for being such a great audience. Let's continue raising awareness. There are colleagues at the exhibition tables with material for you to read. Share with the colleagues. The same has been shared via email with the invite. Let's invest to end TB and other diseases, colleagues. Ladies and gentlemen, thank you and be healthy and safe. Over to you, Program Director. Thank you.
Thank you very much, Mr. Dumisani. Thank you very much. We have reached the end of our program, and I do believe that we learned a lot, and we are going to go back home and reflect, come up with innovative ways to end this TB, HIV, and COVID-19 integration, assist the small mines and grow. You know, there's like a huge growth potential that we have, that I think we are challenged to do. Thank you very much for our virtual attendees. It was wonderful that you graced us with your presence. Thank you very much. We are now going to move out. Lunch will be served in the garden. For the presenters, can you please remain so that you can receive your gifts? Thank you very much. Be safe when you drive on the roads home, and also our visual colleagues, please keep safe all the time. And thank the Lord above for us living today. Thank you.